Welcome to Studio Next. I'm the host, Brad Whitworth. We're coming to you from the showcase at Next 2019 in Las Vegas. And with me on the Studio Next set, I've got two friends from the UK. I've got Jim Ritchie and I've got Paul Watson. Jim, you're from the Salford Royal NHS Trust Foundation, which is a mouthful and a half, but if I say the Salford Trust, that's the good way to go?
Royal, yeah.
Salford Royal, and you're from Hitachi.
Yes, indeed.
And you've announced a partnership, so maybe you could tell us a little bit, Jim, about this trusted partnership and why Hitachi was selected to partner with you in the IT space.
Yeah, so we're really excited. This is a digital transformation of the way we're going to deliver care in hospital. It's going to let us get our patients to see the right person at the right time in the right way for them. It's going to improve outcomes for them, it's going to help our staff, and it's going to really move our organisation forwards. We chose Hitachi as our trusted partner for a range of reasons. The two most important for me probably were the shared vision. They could understand what we wanted to deliver, they could understand the way we needed to develop our capabilities as opposed to just giving us solutions. And when we looked for someone that we want to work with over a really long period of time, 10 years, it was then about our values aligning. And will we work together in a way that's productive, gets us through the good times and the bad. And I think everything that you guys have brought to the table really makes us feel confident that this is going to work together. The honest, open approach, you telling us where you think our ideas are good and where they're able to be improved. It's driven this forwards and it's been fantastic for us.
And Paul, from the Hitachi standpoint, what's working with this partnership and why is it so important to us?
So I think it's the vision that Salford has around their organisation and their approach actually to innovation and driving things forward. It's measured, but it's also, I would say it's a bit of a step change within the NHS as well, around how prepared the organisation is to adopt change. I think that's a really important factor for us. I think in terms of, for Hitachi, it means that we can bring forward innovation from around the globe and we can bring it into a single environment and allow that to be productionised and into an operational setting. And this will really, I think, help Salford and Hitachi to sort of leapfrog and move forwards and really make a difference to society. So.
Yeah, and I think that's key to it. It's helping us make it operational, isn't it? It's the technology with the change and the support to actually embed that different way of working in the organisation. It's going to make this something that lasts.
So if I'm a patient at Salford, how is this relationship, this partnership going to benefit me? Will I be seeing benefits of what sort?
Well, we hope there's going to be a range of benefits. Firstly, we want to be the safest organisation in the NHS. That's our stated goal. And we know that if you're in hospital for too long, you're at risk of harm occurring. So a really important thing for this project is to help us move patients through their journey in the hospital in a faster, safer way. So you know what's happening to you. You know you're getting the care that you need at the time that you need it from the right person to deliver that. So what we really hope patients will see is a much more streamlined process through the hospital to go from the ED to the right ward area, to get the right bit of equipment to help deliver their care at the right time. So we really just hope it's going to be a smoother experience for patients, a safer experience as a result, and one that really drives better outcomes, so reduced readmissions, shorter length of stay. Those are key things that patients worry about, and we think this can deliver those.
Absolutely.
And if you could look into your crystal ball and see the end of the journey, but sometimes these journeys never end, but how do you see things in 2-3 years? What does the future look like for Salford and for the IT function?
Yeah, I think you're absolutely right. I think this is a journey we can't see the end of. You know, what we're really hoping for is a long-term partnership to help us drive innovation. But over the next few years, what I really hope this is going to deliver for our organisation is the chance to look up. The NHS is under so much pressure that staff are used to just firefighting. We live in the here and the now, and we try to manage the next 30 minutes. What I want this to give our staff is the ability to do their day-to-day job easily, without having to firefight, to let them be satisfied in the care that they're providing, but also to help our service develop. They can plan for 3 days, 3 months, 3 years down the line. And that's going to let us improve our services, because we all want to do that. And I think by giving us the ability with some technology to actually understand what might happen, but also to take the pressure off the immediate challenges, it's going to let us get to better change faster and safer.
Yeah, absolutely. And I think, talking sort of maybe once we get past Salford, actually moving that out to the broader group of hospitals and then into the integrated care environment, that's where you'll see some really significant benefits downstream as well.
That can move us to a population health view and absolutely drive value from the ICO,
Well, I want to thank Paul and Jim for coming to Studio Next and sharing some insights into the healthcare organization in the UK, Salford, and spending a little bit of time with us at Studio Next to be able to help our viewers understand what's going on. From the Studio Next set, it's Brad Whitworth. Thanks for stopping by.